Hello, and welcome to the Being Human podcast, where we explore what it means to truly be human, physically, mentally, and spiritually. We upload an episode of this podcast every single week, so hit that subscribe button. You do not want to miss any of these episodes. On this episode of the podcast, I sat down with Dr Waj Mughal. Waj is a medical doctor with the NHS. He actually only works part-time with the NHS now because he has turned his attention to the cryptocurrency space. Waj works for a startup in the space and he's also an online content creator whose content revolves around crypto, DeFi, lots of financial instruments, markets and technologies that I no longer know anything about and are greatly confusing to me. I put on the table to Waj my criticisms, my concerns about modern medicine and about the NHS. It goes without saying there are so many good things, so many things we should be grateful for when it comes to the NHS, when it comes to modern medicine. But I do think it's fair to say there's a lot to criticise as well. As I said, I put those on the table to Waj, and Waj gave me his thoughts, his views on those criticisms. We talked a whole load about medicine, a whole load about doctoring, and we also talked about the other work that Waj now does. I gained so much value from talking to Waj. I trust you will too. If you do, please make sure to hit that subscribe button. Give the video a thumbs up, drop a comment below, share it around on social media. If you're listening on Spotify or Apple Podcasts, make sure to hit that follow button, hit those 5 stars, support Being Human, be a part of the community, help it grow. Thank you for watching, thank you for listening, and thank you for supporting Being Human. So, to start off with, if someone was to meet you on the street and to ask you who you are and what you do, what would be your answer to that?
So I usually always would just say I'm Waj or Wajahat. I'm a doctor turned crypto content creator now. I work for a number of companies. I work for a startup now, but mostly I'm an educator. I think that's probably what I enjoy the most and something that I've been doing for a number of years now. So yeah, that's me.
Yeah, because it's interesting, right? Because when people used to ask other people that question, not even that long ago, just 10, 15 years ago, what do you do? It was a very simple answer because you just told them the company that you worked at and your job title at that company. And now that's not how the world works for so many people.
Yeah.
Because you're doing your own thing. You can have multiple jobs. Some of them you may be in employment. Some of them may be your complete own vehicle that you have autonomy over. And obviously, as you just alluded to, you've got a blend of that. Part-time doctor now with the NHS, and obviously all the things that you're doing yourself on the crypto side of things. Let's take it back to the start. You and I have known each other since year 7?
Yeah.
Year 7,
yeah.
So...
I can't remember how old we were back then, 11 or 12?
11 or 12.
Like that, yeah.
11 or 12 years old. I think we've probably been good friends since we were then 13, 14 years old. And anyone that went to school with you can attest to the fact that you have always said, all the way to back then, and I'm sure before
I know where this is going,
that you were going to be a doctor.
Yeah.
Where did that come from?
It probably stemmed from some, I think when I was younger, I was always a bit of a nerd. I think I always liked science, and I think naturally I was pretty good at it too. So when it comes to career planning around that, it's really what do you want to do if you're good at science? And I think I probably was a little less stronger at things like physics and maths. And I guess I had a tendency to just really enjoy the other sciences. So yeah, I think it probably stemmed from there, just having a strong interest even as a child in science. And then I think there was one moment where I think someone asked me what do I want to do? And I always said I wanted to be a brain surgeon or neurosurgeon. Yeah. And for some reason that always just stuck with me. As I was growing up, as I went through, primary school, secondary school, that was always what I wanted to do. Now that's definitely not what I want to do anymore. We'll talk about that in a bit, but I think that's probably where it stemmed from.
Yeah, so it wasn't because I suppose my assumption was, obviously I have a bit of a personal insight into this as well, the Asian culture and psychology. Asian parents, Asian families often have a vision for where they want their children to go.
Yeah, of
course. And it's going to be a well-established, high-paying, prosperous profession, such as doctoring or lawyering. Just to make it clear, my parents didn't, propel me in the direction of becoming a lawyer. That was my own choosing, unfortunately. But yeah, so it wasn't driven by your parents at
No,
all?
I think similar to you, like every parent, especially in our culture, wants their child to have a safe and comfortable life. And I think you get that by going into some of these, white collar jobs, whether it's becoming an accountant, an engineer, a lawyer, a doctor, whatever. Um, that's a normal thing. I understand it. I can imagine myself like wanting my future children to like have safety. Yeah, I didn't think my decision was really fueled by that. I think definitely my parents supported me a lot in that direction. So if there were anything that would help me to get into medical school, they were all for that. But I don't think they were ever like, oh no, this is the only thing you could do, or whatever. If I changed my mind and said I wanted to become a footballer or whatever, I'm sure they would support me to do that as well.
Oh, that's brilliant.
Unfortunately, I just didn't have the skills to make it.
I definitely didn't have the skills. As you said, it wasn't just you. Our group in general was quite a nerdy group.
Yeah.
Yeah, and we were just talking actually, weren't we, about how that kind of still rings true to this day, and the proof's in the pudding.
Yeah.
I think we all had similar mindsets. Obviously, Colette's been on the podcast, Shamir's episode. I'm going to drop that next week and drop yours the week after that.
Brilliant.
So, yeah, I think the proof's in the pudding that we all shared a very similar mindset toward our studies then, and that mindset really, I don't think has changed too much a decade on. But let's go through the journey then to becoming a doctor, because I'm very interested in that. Obviously, a big part of what I talk about, what I explore is human health on a physical level.
Yeah.
Modern medicine, doctoring is a huge part of that. So we went through school together. We then ended up going to different colleges. You went to Lawrence Sheriff and Rugby.
Yeah.
Talk to me about that experience, because that was quite a high profile institution as far as sixth forms go, right? What was the regime like there? How difficult was studying A levels there? How difficult was it to get into Lawrence Sheriff? Because you had to pass entrance exams, right?
So it was pretty unconventional, because I think if you ask most people around our school or some of the sister schools like around Nuneaton and the area, I don't think many people were like moving to sixth forms outside of the area, and so Rugby was a little bit further away. I think I had to get a train like there every morning, which it
was a commute, right?
Yeah, it was a commute. It was a commute, and like I didn't know anyone who was even going there either. But I think it was a very good decision for me to go there for a number of reasons. I think the most important reason for me going there was the environment. And like it's always the people around you who like help propel you up. So I think that was probably one of the best things I ever did. I really struggled at the start, really struggled. I think I wasn't expecting that level of like competition and environment. I think Lawrence Sheriff was a school where pretty much everyone got A stars and A's, literally everyone. And so when you go from a school where you're like one of the top students, and then go to another school where like you're not even in the picture whatsoever. I think I was probably one of the bottom students at the start.
Really?
Yeah. And so I think the first few months I really struggled. I couldn't keep up with the pace that these guys were going at. They were really smart people, and these are the people that ended up going to Oxford and Cambridge and doing medicine and dentistry and some getting full AAA stars and things like that. So there was quite an adjustment period. I think the commuting as well is like a new thing altogether. All of that when you're at age 16 can be quite a lot to take on board. But it was good. I think after a while I did get a little bit more accustomed to it. I think it probably took me a good part of a year actually. But when the second year came, I was like really settled. I was so focused. I had this vision that I would get into medical school. So I think that's probably like the hardest year that I've ever worked in my life in terms of like pure focus.
Really, to this day.
Yep.
More than med school.
Yeah, definitely more than med school. That second year of A levels, I've never worked as hard, in terms of like pure dedication and focus into like achieving something. Yeah, I don't think I've ever like had that level of drive since then. I have, but obviously in different forms.
I understand what you mean. Because I think in general A levels are more difficult than an undergraduate degree.
Yeah, I'd say doing my A levels was more tougher than medical school.
Yeah.
Which some people think is absurd. Like how on earth can like A levels be harder than becoming a doctor? But I think the problem is like when you want to get into medical school, you can't get A's or B's. You have to really get the top marks. And like that's what I was so focused on getting that. I was not going to accept anything under an A-star really. So yeah, I had to really work hard for that. And like it got to the extent where on my commute I'd be doing past papers, in my break time I'd be doing past papers, when I come home I'd be doing past papers. I did more past papers than probably anyone in my school, like in my year. And it worked out in the end. I think I got probably one of the top marks for chemistry and biology in the entire year.
Really? Wow.
So
So
I went
from bottom
I
to
went
top.
from bottom to top. I think I got like 99.9% or something stupid like that, which I can laugh about now. At the time, I was like happy with that, and yeah, it wasn't easy though. It wasn't easy. Like I really dedicated every hour of my life to that. I didn't go out to have fun. I wasn't like, even weekends I never took off. Every evening I would be smashing out like revision and past papers, but it was worth it. And if I went back, I'd do it again.
Yeah. And it must have set you up with such a foundation. You must have, obviously, mental resilience is one side of it. You must have developed a great amount of mental resilience because that was a real sink or swim situation. A lot of people in that situation, a long commute, being put into a very competitive environment, a great workload. I think the step from GCSE to A level is big, regardless of what sixth form you go to. So to then go to a regime like that really is a sink or swim situation. So obviously you would have developed a lot of mental resilience, but imagine as well, like the foundation you would have laid in terms of your productivity protocols, learning how to work efficiently and to deadlines. That must have set you up so well for med school.
Yeah.
And I imagine that's one of the things that kind of made med school easier in a way.
Probably. I think like I guess one of the things when it comes to like exams is it's not really about how smart you are. It's just about how much you can play the system. And the thing is, the system that we have here in the UK is like it's all about your revision technique, but also like a lot of it is memory, a lot of it is regurgitating.
Massive part is memory recall.
Yeah. So it's about playing those games and understanding that. And like when you realize how to get an A-star or an A, it's not about like you understanding this crazy concept. It's about like your memory and like your ability to recall information and your ability to apply information. And you can get that by practice. You can actually practice your way. So if I'd say this, even if you're a student who got D's or E's or C's, I think you can still get A-stars. It's not difficult in the sense of like the content is not difficult, but it's difficult in the sense that you have to really spend a lot of time. You have to dedicate your evenings, but you can do it. I think most people can get A-stars and A's if they really try hard enough.
I agree. And I think they're the two tongs to it. One is you've got to be organized enough in your in the way you study and then your revision of the topics so that you're able to develop excellent memory recall. Then the other part of it is knowing the game. That's one thing I understood with exams, with academics, but then also as well with law. And I imagine it's the same with med school. Getting into any industry, it's not who's best, it's who can play the game the best.
Yeah.
It's the same with everything. And you've got to do those past papers. You've got to know what the examiners are looking for. So it's not just about being the most intelligent, being the cleverest, being the hardest worker in the room. It's the person that figures out the game and learns how to play the game the best. I think that's true for any area of life.
Yeah, so I think in that second year, that's when I really figured that out, and thankfully that worked out well for me.
Yeah. So what were the end results, the subjects and the grades by them?
I got 2 A-stars and an A. I missed out for the A-star in maths.
Okay. Yeah. So chemistry, biology, maths.
Yeah.
And are they the A levels that you need to choose if you want to go on to med school, or is there a bit of flexibility there?
You don't need to choose maths. You can just go with I think for some medical schools, chemistry alone is enough, but I think for the majority, you got to do biology and chemistry.
Okay.
Yeah.
Okay.
But this has been this was quite a while ago now. We're like in a mid to late 20s.
It feels
now.
like yesterday, but it was a while ago.
Yesterday, but like so perhaps things have changed slightly now. But I think like, yeah, biology and chemistry were the main ones.
Yeah. And you said that you struggled more with physics and maths,
Yeah.
and you grooved more, if that's the right word, with biology. What do you think it is to that? Do you think that's just kind of a natural, not disposition, tendency, a preference you had, or do you think there's a certain element of it that appealed to you more?
Yeah, it's really weird because at the time I thought I was better at maths than anything else, or at the time. But I think yeah, it's probably just like what you focus your time on the most, I guess.
The Being Human podcast is now brought to you by Mr. Bassett's Grapplers Coffee. If you're listening to this podcast, the chances are you consume caffeine. Why? Because the vast majority of human beings consume caffeine. Caffeine is a performance-enhancing drug. If you're not using caffeine at least some of the time, then in my opinion, you're leaving far too many gains on the table in whatever it is you're doing day to day. And when you do, you want to make sure you're consuming it the right way. Mr. Bassett's Grapplers Coffee is a classic Italian style coffee. It tastes tremendous. It does the job. It will get you firing on all cylinders. And it even comes with some very helpful instructions. It says drink half a cup before flow rolling, 1 cup before 6 a.m. open mat, or 2 cups to wrist lock, punch choke, and oil check everyone into oblivion. So if you want to be getting more wrist locks and oil checks on the mat, and let's be honest, who doesn't, then you want to be consuming Grapplers Coffee. So head over to mrbassets.com now and get yours, and use the code WAG10 for 10% off. The link and details is also in the description below. So then obviously the next step was med school.
Yeah.
Talk us through the process of med school. For somebody that doesn't have any idea what med school entails, what the path to becoming a doctor entails, talk us through it in terms of how long is the study at university, what are you studying each year, like what kind of content are you going through? Take us through it all.
Well, the first thing is like getting into medical school itself is not easy, because even if you get 3 A's or 3 A stars or whatever, you're not guaranteed a place. Medicine's a little bit different to other university degrees because you have to do another entrance exam before you go. So it's called a UCAT exam or a BMAT exam. Essentially, it's an aptitude test. It tests you on like really random things that you wouldn't even think of that you needed for medicine. So like you'll have like questions where you have like different shapes and you need to decide like which shape joins the pattern. And like the criteria can be things like, the number of sides in that shape or the colors of the shape or things like that. There's a literacy component to it. There's many components to it, and you don't need any science knowledge for this exam whatsoever. So anyone can actually do it. So that's one thing. So you have to score pretty high on that. And every medical school will rank you differently. So some medical schools will have more preference to the aptitude test. Some medical schools will prefer more focus on grades, and some will focus more on the extracurricular stuff that you've done, because that is also another core component. You have to get yourself some work experience, perhaps in a GP practice or a hospital, or working in a hospice or doing charity work. You have to show that you're not just like everyone else. You've really gone out and, when you were in school or when you were in sixth form, you'd sacrifice your weekends to do these crazy things to help develop you as a person. So like you have to do all of these things on the side of like studying for your grades. So that is like a tough component of it as well. And then you've got the interview as well, which is like a very, very tough interview. I had multiple types of interviews for the medical schools that I applied to. One of them was like a panel where you've just got like a board of like 3 people just questioning you, and the other is like this like mini interview station kind of system where you have like 10 different rooms that you go into one by one. Each of them will have a different scenario, and you kind of have to figure out what's going on and solve that scenario. Some of them can be really tough. Some of them are a little easier. But like, yeah, you got to pass all of those steps and then you can get in.
That's like akin to the process I had to go through, not to study my law degree, not to get into law school, but to get into a firm to actually get the job.
Yeah.
So this isn't even to, actually start practicing as a doctor.
You're like 17 years old at the time, and you're like going through this. And yeah, that was kind of crazy. But I think the great thing was like, because you have all of these different steps like throughout the year, every time you like do one and you get your feedback, it's kind of like a mini boost. So I think that's one of the reasons why I did well, was because, you know, I'd start the year, okay, I did my UCAT exam, I scored pretty well on that. I got like a mental boost, and like that like drove me to like keep working for the next few months. Then I had the interview, or I got the interview, okay, a little boost. You know, you get motivated for a little while longer, and then you know, you pass your interview, you get the offer, you're motivated for a little while longer, and before you know it, the year's over. So I think that really did help me. So yeah, once you get into medical school, like it's pretty good. There's medical schools do them differently, but generally you have a preclinical component, and then you have a clinical component. So it's basically split into two. So for me, the first 2 years were preclinical. Those would be like studying any other science degree, really. You're going to be learning the biology of all of the different organs in your body, how they work, the physiology, how they function, the anatomy, like learning all of your muscles, your nerves, your veins, all of that sort of stuff.
Is it true you have to learn the name of every muscle, every bone in the body?
Yeah.
Pretty much.
Yep,
is it every single bone? Because every muscle,
every single.
I'm not going to pretend I could do it, but I think I could do the majority.
I mean,
but every bone is like another level.
Muscles are way harder.
Really?
Way harder, because it's not just learning about the name of the muscle, it's also learning about their insertion point and their origin point.
Okay.
And also like their function. So like, you know, in your forearm, you've got like three components. You've got the top or the superficial component, you've got middle component, and a posterior component. And like within just your forearm, you've got 20 or 25 muscles. So you'd have to learn, flexor carpi ulnaris, it originates from this point and it inserts on this point. Its function is pronation or supination. Its innervation is via this nerve. Its supply comes from this nerve, from this artery. So you got to learn that for each of the different muscles. And then you think about like how many muscles you have in your hand, your arm.
Okay, yeah, I'm talking bullshit. I can't name you a single muscle in your hand.
Yeah.
How many muscles are there in total in the body?
I don't know off the top of my head. Loads.
More than bones?
Yeah, definitely.
Because like, there's so many bones in your... How many bones are there in the body? Like
206 or something like that.
16 or
200 or something.
Yeah. Okay.
Honestly, I have forgotten a lot of my anatomy. A lot of my anatomy. Anatomy was always my worst subject by far. I hated it.
Because so that would be the most... That's like kind of my interest, my expertise in physical health.
Yeah,
so that's sense. My interest. But I can imagine it's just a nightmare having to...
because
that knowledge.
Yeah, it is, because like I guess it's like in school where you learn like pointless stuff that you don't actually need in your day-to-day life. I don't need to know the insertion point of the flexor carpi ulnaris, but like it's just something that you had to learn in medical school. And I guess like if you're a surgeon, of course you need to know that. Like 100% you need to know that, but I'm not a surgeon and I'm not planning to be one, so yeah, I guess it's pointless information for me now. But like it goes so deep, because it's not just bones and muscles, it's veins, it's arteries, it's capillaries, it's lymph nodes, it's even the anatomy of the heart, the lungs, the stomach, the bowel, everything. There's something. One of the cool things that we had was our medical school being one of the biggest in the whole of Europe. We had people who would donate their body to science, and so we would actually be dissecting real human bodies who had been donated to science. So in terms of like learning anatomy that way, like it was one of the best ways. You've got an actual real life a body there, or cadaver is what we call them, that you can actually like take apart, really appreciate the anatomy, and I think it's one of the best ways to learn, because it's a very visual thing, you know. Like learning anatomy, like you want to like look at the ulnar bone, for example. You want to see all of the different landmarks on it and things like that, so that really makes a big difference.
Okay. And what was that process like, dissecting human bodies? I imagine it was a bit strange at first, right? And do you kind of become desensitized to it over time?
Yeah, you do get desensitized to it over time. But yeah, the first time there's always someone who faints. That's pretty normal. When you go into the lab, there is a smell of like this chemical. I think it's called formaldehyde, that they spray on the bodies to basically preserve the tissue. So like that smell is really strong. But yeah, after a few times, like you get pretty used to it. I think the first time is pretty scary. Like you're like, wow, this is someone who's sadly passed away, but they've donated their body to science. And I think sometimes people can get a bit sad, because you'll see like their tattoos, and you'll see like things that represent their family and their personality, and you're like opening them up now, which is a crazy surreal experience. I can't really explain it other than you got to see it and you'll figure it out.
Yeah, well, that's it. I would define it as a spiritual experience, which is almost kind of like an oxymoron because it's a scientific process.
Yeah, yeah,
But
yeah.
the way I view it, they work hand in hand, and
Yeah.
we'll get onto that a bit later on. But yeah, like to dissect a human body of someone that's passed, and I imagine that's passed not too long ago.
Yeah. I mean, these bodies are probably maybe a year old or something. So,
Okay, that's older than I thought.
So we work on them for the entire year.
Yeah.
So like every group will have like one body, and when you're in your first semester, you might just be covering like the cardiac and the respiratory system. So you'll cover that first. Maybe in the second semester you'll be covering the bowel and other components, and then you'll cover the brain in another semester. So like you'll go through it one by one, like one system at a time.
Yeah. My interest and curiosity in this is going to come across as though I'm some kind of Jeremy Dahmer character. But I'm intrigued.
Yeah.
When the bodies come to you in the lab, is it the full body and you're actually dissecting from the full body, or does it come to you compartmentalized?
No. You have the whole body.
You have the human there,
yeah,
the vessel,
from head
the whole,
to toe.
from head to toe.
Yeah.
And you literally work on that human for the entire year.
Yeah.
So that's I can imagine that's a spiritual experience.
Yeah.
I
think especially like because over time like there's like a bit of dysmorphia, so you can't really recognize the person or anything like that. But like you can recognize them from their tattoos and things like that, which are really personal. So I think like some people really feel a little sensitive when it comes to that stuff. But you do get desensitized to it. At the end of the day, like you're there to learn, and you haven't got much time.
Yeah.
So you're there with a focus. It's very full on. It's very strict. There's no messing around when you're in the lab. It's a very strict environment. So
the process takes over.
Yeah.
So that's part of your preclinical
years.
Training,
so for the first 2 years, you're doing like anatomy, physiology. You're learning about all these different things. You're doing ethics, and you're also, one of the cool things in medical school that I saw was you learn how to talk to patients as well. So we have like actors who come in, and we do like simulation training where like we'll learn how to take a history from a patient. We'll learn like some of the different things that you need to appreciate and think about when you're talking to a patient. Learning a lot of communication skills actually. So I think this is one of the reasons why doctors are good at talking. You learn how to talk in medical school, like how to extract information, or like how to be compassionate, how to be empathetic. Like there's tools that we use for them. You do that for 2 years, or 3 years, depending on which medical school you go to, and then you've got 3 years of clinical years. So you don't go to university anymore, in the sense like you're not in the medical school building. Now you get allocated like a hospital. So you'll go through different rotations in the hospital for the next 3 years.
So your preclinical is like your university degree.
Yeah.
And then after those 2 years, maybe 3 years, then the rest of your med school, the rest of your medicine degree is on-site training.
Yeah.
Okay.
Yeah.
Right. So talk us through that.
Yeah. So like you get allocated to hospital. You'll go through like 4-week placements. So you'll start off maybe on cardiology, then respiratory, then gastroenterology, then neurology, then dermatology, surgical stuff. You go through pretty much everything. So by the time you finish medical school, you've pretty much covered not every specialty, like not all the niche ones, but all of the main ones you would have covered, and you would have had some experience. You would go to ward rounds where you basically see all of the patients on the ward in the morning. You'll go to clinics, outpatient clinics. You'll go to theatre. You'll get to watch operations. You'll still be at the same time. You still get teaching on like how to take a history, how to examine a patient. You'll have clinical teaching where you learn about these different conditions, learn about how to investigate for them, how to treat them. There's a lot of stuff that you have to cover, because think about like every single condition you really need to know. You really need to know them. So that's why it takes like a long time. 3 years pretty much covers you for that. And then you have like exams in between, like every semester as well.
Okay, so again, a really full on.
It's really full
period
on
of studying.
Yeah,
not
it's
just
really
studying,
full on.
but practicing.
I think it's really full on because like the type of person that goes to medical school is generally going to be quite competitive, and you can really see that when you go to medical school. Like just like it gets a bit full on sometimes. Some people are like don't really want to share their information with you because at the end of the day, we're all competing with one another. Our grades are based against each other. So not everyone in the year can pass. Not everyone in the year can pass. So yeah, everyone is like fighting with one another. There's a lot of egos there. It's very, very cutthroat, and the competition is pretty intense.
Yeah. Okay. Yeah, that's really interesting. So there's not it's not an objective standard. It's not objective grading.
No.
There's a certain amount of places, and obviously by default of that, you're going to be scored not by an objective metric, but rather in relation to how your peers are doing.
Yep.
Okay, well, that's really interesting. I can imagine that just breeds such a competitive environment.
Yeah,
it ignites the competition.
It's toxic at times.
Yeah,
but but I was lucky. I basically found my little group, stuck with them the entire time, and yeah, it was okay. I was very social at the start, but I think generally what you'll find is most people find their bubbles and find their groups and settle down, and then.
Yeah. Even in, I think this is true in anything, in any arena of competition, tribes will emerge. Even when it's a sole individual competitive endeavor, obviously the easiest example for me to give is fighting, grappling, MMA. You go out there by yourself. You compete ultimately for yourself. You're not competing as a team, but you are in the sense that you have a team behind you. You've got your training partners, your coaches, so you do have your bubble, you have your tribe, despite you being an individual competitor. We can get on to that. That's a whole other tangent. There's something about that I've got such a competitive spirit. It ignites the fire in me. Is that something that you have as well? Obviously, you're incredibly driven and ambitious. I know that, but for me, I love not just striving for a goal. I love competing against other people.
Yeah, I think I do as well. It's something that like I've been doing in a different form to you, but I have been doing since I've been growing up. So yeah, it's a part of me. I like the competition. It drives you to work harder, drives you to compete. Competition drives innovation in general. So yeah, I like it.
That's it. I think it's a good thing all in all. Like you said, it can be very toxic in the sense that people's egos get into play. Your ego has to get into play if you want to succeed in any competitive endeavor. But if you're able to kind of keep that third person perspective to kind of like view the arena as a fishbowl in which you're looking into, if you're able to remind yourself of that and remind yourself at the end of the day, as much as you are competing in that arena, again, going back to it, it's just a game at the end of the day, and life and everything that makes it up exists outside of that arena.
And
I think if you're able to maintain that perspective, then you can enjoy competing in the arena and get the most out of it for yourself and the other people that you're competing against. I think in the optimum arena, to keep using that metaphor, competition helps make everyone better, regardless of whether they win or lose in the game.
Exactly, that's what I said. Competition drives innovation.
Yeah,
I think it's a good thing. It drives you to work harder, to figure out where your faults are, how you can improve. Without that, people get in their comfort zone and people aren't looking to get better because they're already winning.
Yeah. So, how long was your clinical training period?
So in total, like my whole time in medical school was 5 years. Some people do 6 years because they do an additional degree. It's a weird thing in medicine that you can do is where like you can join year 3 of like another science degree, and like you can get another degree out of it.
Degree.
Yeah. So like my missus and my sister like both did that. So they'll have like they got 2 degrees essentially. I didn't do that. I just wanted to finish and kind of move on to working life.
Okay, so let's get on to that. Obviously, during your clinical training, is there a process you have to go through to start looking at where you want to work, applying to specific hospitals, or do you get drafted? Because I believe in pharmacology, you get drafted to a certain pharmacy, and that could be anywhere in the country.
Yeah,
I believe that's how it works. How does it work?
So
in medicine.
So when I graduated, it worked like this. So you would have to first of all rank all of the different places in the country that you wanted to work, including Scotland and Ireland and Wales.
All of them.
Yeah. So there's like so they call them deaneries. So like like what you'll have like West Midlands Central, West Midlands South, West Midlands North. There's like
Okay, so it's not every institution. It's not
no,
every
no, no,
hospital.
not every. So you rank all of them first, and then you'll get shortlisted into a place, and it depended on your grades. Now they've changed it, and now it's random. I think what was happening is you were getting concentrations of places where people wanted to be, like Manchester, Birmingham, and Liverpool. Not Liverpool, London, sorry. People want to obviously be in big cities, and so you're getting like the top students all moving there, and like someone in Grimsby like was like the
And then you get the Neaton.
yeah. I think the Needs is still fairly popular because it comes under like the West
Okay,
Midlands,
okay.
but like somewhere proper remote and random.
Yeah, Inverness.
Yeah, like who the hell wants to go there? Unless you live there already, like who the hell wants to go there? So like in order to like help ensure there's a balance of people, like top students and kind of lower down students, like to ensure there's a balance, they've randomized it now.
Okay.
But when I graduated, it was based on your grades in medical school, and there's an exam that every single person sits at the end of your 5 years. The same exam for everyone across the entire country, no matter which medical school you go to, and it's basically based on that. So yeah, you rank all of your deaneries, and then once you've got into one, you'll then have to rank all of the hospitals within that area as well. So if you're in London, if you're in one subsector of London, there will be like maybe 10 or 15 hospitals in that area. So you rank them, and then you rank like all of the different jobs that you want to do. So those jobs could be things like urology, psychiatry, GP, A&E. Like you rank them all.
Wow. Oh, that's, for some reason that goes against to me what makes sense in my own mind. I thought the first port of call, the first option you would make is
what job you want to do.
Yeah, what job you want to do.
Yeah.
And then where you want to do it.
Yeah. I think it's probably just the way to like filter out people and like
Okay.
yeah, that's just how it's been done.
Right.
So you pick which jobs you want to do for the next 2 years, and that's because you're doing something called your foundation training. You're a fully qualified doctor, but you have to. Everyone in the UK has to do this, and once you've done that, then you can go into your training, or your residency is what they call it in America. Yeah, I did that. I went for quite a wide variety of jobs. I did urology, I did psychiatry, I did renal medicine, I did acute medicine, I did histopathology, which was pretty interesting, and then I did general practice, GP.
Wait. So these were the options. So you select your options.
So you have to pick 6.
Okay.
So you pick 6 because you do each one 4 months.
Then you do each one of those options.
Yeah.
Okay, that makes more sense to me. I thought you'd done all your training and now you were selecting your job, and you were first selecting where you wanted to go, and then kind of as an afterthought you were saying, oh, well, I'll do psychiatry here. Then all of a sudden you rock up to
No,
the George Eliot, I'm a psychiatrist.
Yeah. No, this is only for 2 years.
Okay.
And then once you've done that, then you choose like the one specialty that you're going to do for the rest of your life.
Right. Okay. So let's go into those 2 years of foundational training.
Yeah. So yeah, I did urology, psychiatry, renal medicine, which was probably the toughest. And then I did acute.
Forgive my lack of medical understanding. By renal medicine, we mean
kidneys.
Oh, kidneys.
Yeah. And then I did acute medicine, which is pretty much like a general medicine stuff. Histopathology, which is in a lab, and then GP to end it off.
And GP. Oh, GP.
GP, yeah.
Okay. And is there any particular highlights, if that's the right word, of those years of foundational training? Any key insights that stick with you in any of those areas?
I think like being a doctor, like I didn't use a lot of the knowledge that I learned from medical school to become a doctor, because it doesn't really work like that.
Right.
I obviously use my clinical stuff. I need to use that all the time. But like in terms of what I mentioned before, like my anatomy, I never needed to know like the innervation of the gastrocnemius muscle, like for my day to day work. I think like being a doctor is more about like some of the personal skills and some of the communication skills and really being empathetic, because often like patients are in hospital, they're already on the right treatment, they already have things in place. I think the most important thing for me was just like learning what to do when things go wrong. So I had a lot of scary moments like that. Most of the time things were generally okay, but I got to experience like some crazy times. patients would be fine 1 minute, and like the next minute you're the only person there. And bear in mind, you've just graduated, you've been a doctor for a year or 6 months or something like that, and now you've got this patient who's like needs your attention, and you're the only person in the entire area that can help. So things like that, your heart rate definitely goes up a bit. Those were some really like incredible experiences that I've had, especially when it goes the right way as well. Sometimes, of course, it doesn't go the right way. Sometimes patients do pass away. That's a part of life. You can't do everything for them. So yeah, I had a great time. I really enjoyed it. The rota and like the timings of my shifts and stuff were a bit tricky. I had to give up a lot of weekends. I'd do night shifts. I'd be working on calls, twilight shifts, which finish up midnight. So your work-life balance can at times be a little bit different to your friends who are on 9 to 5s. It can be a bit tricky. And also, like your friends within medicine, you might be on a night shift, they'll be on a day shift. When they're on a night shift, you're on a day shift. So especially with my wife as well, that was something that we struggled with a little bit. But I have to say, the actual job itself, I really enjoyed it. I loved it.
Okay. So the foundational training, so let's take psychiatry, for example. You rock up first day of your 4 months in psychiatry.
Yep.
How much supervision do you have from a senior doctor? Or is it quite,
you're
out there on your own?
Yeah, I mean, to be fair, in psychiatry, like there was always a consultant who's like the most senior level of doctor that you can be in this country. There was always a consultant around. At times, like they'll go home, so you will sometimes just be the only doctor that's around, and so you'd have to sort stuff out yourself. But like the good thing is, like, I think generally people are supportive, so they'll give you their phone number if you need to call them, if that you need advice. Like there will be someone senior who is on call, which means like they are ultimately responsible for that patient.
Okay, so let's take another area that might be a better one to talk through, because obviously psychiatry's, it's
you don't really have that many emergencies in psychiatry.
Yeah. So let's take like renal medicine.
Yeah, in renal medicine you had a lot of emergencies.
Yeah, that's what I was imagining. You rock up on your first day, 5 hours into shift, bang, someone's having a kidney failure. You're there by yourself.
Yeah.
What do you do? Like, do you just have the knowledge on hand there from your medicine degree to go, this is what we're doing?
No, the thing
you do this, you do that.
Yeah.
What resources are you pulling from to help this patient?
So the thing with renal is that these patients are often patients that have multiple comorbidities. You don't just have kidney failure and that's it. You often have heart failure, you'll have high blood pressure, diabetes, multiple other problems, and kidney failure as well at the same time. And so they are quite complex. They're quite unwell generally. If you're a kidney patient on the ward, you're generally not going to be the most fit and active patient. Most of them have been smoking their whole life or drinking their whole life. So they have all these other problems on top of that. So it's not really a straightforward thing. Half of the time they can't even maintain their blood pressure as well, which is another problem by itself. So like when it comes to those situations where like you're the only person there and like you've got this patient who's suddenly crashing on you, who's like they're not being responsive, or like their blood pressure is tanking, or like their heart rate's going super high, and you're like, what the hell's, someone's put the emergency alarm on or something, and you're the only person there. We have this system called ABCDE. And that's basically the way that you have to formulate in your head, like what you need to tackle first. So it counts. A stands for airway. So you look at the airway, make sure the patient's breathing first. If they're not breathing, chest compressions or whatever, if that's suitable or not. Then it's like breathing. C for cardiac, D for disabilities or like generally abdominal stuff, and E for everything else. So in my head already, I know all of the different things I need to go and check through. It's essentially a checklist. So the most important thing is staying calm, making sure you're going through your ABCDE and then revisiting it again after. And with every single thing that you pick up, you treat it then and there. So if I'm on A, okay, A is fine. If I'm on B and there's a problem with their breathing, I fix the breathing problem then and there before moving on to C. And so you have all these algorithms in your head that you essentially go through. Often, because these patients are complex, you might not know like the exact specific problem, and so that's often when you need to call for help.
Right. So you've got consultants, senior doctors you can call to say, look, I've gone through my ABCDs.
Yeah.
There's this problem, there's that problem, and they'll tell you, we need to do this procedure, or they need this medicine, they need this drug, that
Yeah.
kind of thing.
Yeah. I mean, most of the time you know what to do, but it's more like in the specialist cases, like if you need some extra advice, especially if it's for a complex patient. The problem is like those people that you call probably aren't even there, or they're not in the hospital, or like they're in the office or something. So like in a real like life-threatening emergency, we have like an emergency buzzer that you can pull, and then someone called the crash team will come, and the crash team consists of like a senior medic, multiple other medics, like a whole team basically comes running. And sometimes I'm on the crash team myself, and so I'll just be chilling, doing my prescriptions or something, and then all of a sudden my buzzer just goes off, and you just have to run, and like really run, and like it can be in the other side of the hospital, so you're running for like 10 minutes, you're sweating and everything.
So you've got to have a good, if you want to be the best doctor, you've got to have a good mile time.
Yeah. There's a few times where I've been sweating a lot just from like running from one corner of the hospital to the other corner, and it's taken like 5-10 minutes to get there. Sometimes you have emergencies like even outside of the hospital, so you're like figuring out like where on earth are you even going.
They're in the car park.
Yeah, in the car park. Yeah, exactly. So things like that happen. It's pretty exciting, but yeah, I do enjoy it. There's one time where I think it was like I just became a doctor. I think I'd only been working for maybe a month, and I was doing a night shift, and I was in like a district hospital, so quite a small one. So generally what happens is in this particular hospital, normally this doesn't happen, by the way, but in this particular hospital, because it's so quiet and generally patients are like pretty safe there, there's only 2 doctors or 3 doctors in the like covering the whole place, because it's like a very, very small, it's more like an outpatient hospital, nothing like the main hospitals at all. So at night what happens is most of the people just go to sleep. And if they need anything, they just get a bleep and they'll wake up and sort it out. Now, I hate the idea of sleeping like when I'm at work, or I would never do that.
The doctors would sleep.
Yeah. I've never done that. I never could do that. Like for me, like especially.
I was going to say that seems like not the best protocol.
It's a very, very small district hospital. It's not a normal thing.
So that's not something that would happen in.
It wouldn't happen in any of the hospitals here.
Okay.
Like these are much. Like this was a very small, quiet hospital.
There's not an A&E department.
No, there's no A&E department there or anything like that. So we got told to go to this place for like 4 weeks at a time, just to like experience surgeries and things like that, because they were all done as an outpatient. So during the day there's stuff happening, but at night there's nothing going on. But these patients have just had their operations, so they need to stay in hospital for a day, and then they go home the day after. They're not complicated whatsoever. They're very straightforward. They're young, healthy people most of the time. So at night, there's often not really that much for you to do. So that's why there's only 2 or 3 doctors covering the whole place. And so most people would often go to sleep. Like I would have too much anxiety to go to sleep in a place like that. So I would just change my sleep schedule. So I sleep during the day and I'm awake during the whole night. And often like I would be busy enough because me being the most junior, I have to do all of the work. And so I'd be up like doing bloods here, doing a cannula here, prescribing the fluids here, prescribing that there. This patient's got chest pain. Like, you're basically handling it all yourself while your seniors are asleep. And there was this one time where they were all asleep, and all of a sudden the emergency buzzer goes off, and I go running, like trying to figure out like what's going on. And I just see this patient just like collapsed on the floor in the middle of the corridor. And like I've only been a doctor for like 2 months, so I wasn't thinking logically. It was about 4 o'clock in the morning. I was pretty tired, and I just go up to this patient. I start going through my ABCDE. I'm trying to figure out like how do I get the patient up. The patient's like completely out of it, like on the floor. I'm like, I can't be doing like ABCDE like on the floor here in the corridor. I need a bed. There's no one around. I'm like, the emergency buzzer's pulled, but no one comes, and I'm waiting, and they're all like asleep. So it took them ages to wake up, come from their bed, come over to the hospital. So like I had scary moments like that. I've just been by myself, just trying to figure stuff out.
Wow. And what did you end up doing? What happened?
I think it was a stroke or something like that. So you have to like follow the protocol. Every hospital has guidelines on what to do. So it might be prescribed, give them this, or transport them to the Queen Elizabeth or any of the big hospitals or something like that.
Okay. But like in terms of the practical steps, obviously you said you need to get to a bed?
Yeah,
Did you just have to wait for the other doctors to wake up?
I had to go and run and find some nurse who was able to bring a bed, and then like we'd have to like safely, pick the patient up like onto the bed. You can't examine a patient properly on the floor in the corridor. So yeah, then you do that, and then thankfully the patient was generally okay. So yeah, but you do get scary moments like that where for a split second you're like, oh crap, what do I do now? That's a part of it. So yeah, I've had many scary moments like that, but I've enjoyed them. They're generally quite good.
Do you mind talking about patients that have passed away?
Yeah.
You were attending to them?
Yeah.
Talk me through the first time that happened.
I think it would have been on my first ever rotation, so on neurology. I think the first time it was probably a patient who had cancer who was going to be dying or like in the process of dying. There wasn't really anything that would have changed that pathway. They were elderly patient as well. So I don't think the actual process of them dying was particularly upsetting. What was more upsetting was like that was the first death that I had to verify, and so when you verify a death, you go into this room. You have a patient that's lying there, and you have to like do some different tests to make sure that the patient has actually passed. So the first time I did that was definitely quite daunting, and it is a little bit scary. You kind of some of the thoughts that I had in my head were like, this eventually one day will be me. This could be my family member. This could be, a friend, someone very close to me, and this is like a part of life. But like when you're in that moment and you have this body in front of you, there's a eerie kind of feeling to it. So yeah, it probably was a bit spooky and a bit scary the first time, but over time you generally get accustomed to it and it becomes pretty normal. I don't really like doing it because I like to give the patient who has just passed away, some peace, and it's not really that much peace when you've got me like prodding around, like listening to their lungs, listening to their heart, like looking in their eyes and stuff like that. But like someone has to do it, of course, because otherwise, how can you verify?
Because otherwise, they need treatment.
Yeah,
if they're not dead, they need imminent
exactly.
treatment because they're pretty close to
Yeah,
death.
exactly. So yeah, it is a bit of a spooky feeling at the start. I think even today it still feels like that when you're in the room with someone who's passed away. But yeah, that's a part of what we do.
Have there been any instances where people have passed in a particularly difficult manner, in a surprising, unexpected manner, or even just outside of that, any patients that have passed where you've found it particularly upsetting in one way or another?
Yeah, many times actually. I think I can think of quite a few off the top of my head, like a few times where I was like seeing a patient and I was particularly worried about this patient. Their observations and things weren't looking so good. And I started all the treatment, like giving them IVs, giving them fluids, giving them this and that, and like things weren't improving. And like I tried to get senior support to try and help me with this patient as well, putting them on high flow oxygen and all these things. But like my senior was operating at the time, and so like they weren't able to come. So like I was just having to deal with this all by myself. Um, and like nothing I was doing was working. So like hour by hour, I could just see like just things weren't working. And so after like 6 or 7 hours of just trying to solve this problem, like with the patient's oxygens or the observations and things like that, it was pretty sad. Like eventually, like when the patient does pass away, and you've got to break the news to the family. Like that's always a tough thing. Breaking bad news never gets easy. It's always a difficult thing. I mean, there's no real nice way to put it, is it? But yeah, that's been tricky. I think like other times, perhaps when I've had a relationship with a patient, I've seen them on the ward for like 2 or 3 weeks. They've shown me pictures of their children. They've shown me pictures of their family. They're like looking forward to like leaving hospital, and things obviously go the other way and they pass away. That's obviously quite sad too. Especially when you build like a bit of a personal relationship with them too, and they've shown me like personal things about them or told me personal things about them, and you see them every single day. You see them more than your own family for those 2 weeks because you're there at work. So yeah, those have been quite sad, but that's part of being a doctor. Not everything will be happy and smiley.
Yeah, I imagine a lot of the times, and especially for some areas of medicine, quite the contrary. Actually, most of the time, it's going to be quite a despondent business
I think
day
they're
to
good. I
day.
think most of the time things are good. Like 99% of the time things are good. You do well for the patient. Patients get better. They go home. They're happy. You're happy. You feel satisfied. But of course, there is that 1% of times where no matter what you do or everything that you try, it doesn't work out.
In those times, how do you deal with it on a emotional level? How do you process something like that? How do you? Because obviously, I'm just trying to put myself into your shoes.
Yeah.
We'll go on to this actually in a bit. I've spoken out about certain criticisms I have about the NHS and modern medicine, and we'll get onto that. But one thing I want to make clear is the admiration I have for people like doctors, firemen, people in the military. The emotional burden and tax that can be on these jobs is phenomenal. And I've got such admiration for it because I don't think I could do it. And I think if I was going to a job where I was having to watch people pass away on
Yeah.
quite a regular basis, I'm not sure how I would deal with that emotionally, how
Yeah.
I would process that. So how do you do that?
It's quite hard actually. The first few times you don't get a chance to process it because there's 50 other patients on the ward that you have to cater to. So if someone passes away, you don't have time to grieve about it then and there. You've got like other patients that are unwell on the ward, so your focus is on them. So you don't really get much time to process it. I think probably like when you're driving on the way home or like when you're later on in the day, that's often when you feel it a little bit more. And you know, a lot of my colleagues have like I've seen them crying or I've seen them like really upset. You know, even a day or two after something like this happens. It's a normal feeling. Yeah, it's difficult because like when you're in the workplace, you just don't ever get an opportunity for that. Your job there is not to worry about that, but to like focus on the rest. So I think everyone will kind of tackle it differently. I think I was generally quite resilient with it. I didn't really find it too much of a burden on myself, but you know I do get upset. But I think about like I focus on the good parts, which 99% of the time, you know, if someone passes away in a day and it's quite a sad thing, you probably would have solved or saved, you know, maybe 3 or 4 or 5 other patients. So I try and like have a positive outlook. Look, I know that there will be times in the future when I go to work and a patient will sadly pass away. But I also know that most of the time when I go, I will be doing a good thing and I will be helping someone in some way, shape, or form to get better. And so but by focusing on that, I think I'm able to deal with it a little better.
How much do you think your faith helps with it? Obviously, you're Muslim.
Yeah,
Does
yeah.
that play a big role?
Oh yeah, definitely, definitely. Because like at the end of the day, like I told you before, like when I see like patients who have passed away, like, it's a reminder to myself that you know one day this will be me. I don't know. It could be tomorrow. It could be 50 or 60 or 70 years time. There's no way for me to know. Something could happen to me in a month or even in a year's time. So it's a good reminder for me that you know life is limited. You have to make the most of the time that you have on this planet. And so yeah, it's a good reminder for me to like always be good to people, don't do harm to people, forgive people because you know I might not get a chance to do that in future. To make the most of the time that we have here, to really not waste time, to really not to focus on things that are good. So I think my faith like really helps with all of that stuff as well. So yeah, it's always a good reminder.
Yeah, that's it. As much as I can only imagine how challenging it must be, the positive side to that is it gives you a constant reminder of your mortality and the fact that we are all mortal.
Yeah.
I think that is almost the most. That's kind of the key thing about being human is that we are mortal. This existence is a finite one.
Yep.
It's not forever.
Yep.
And whatever we do in this existence, in this lifetime, is effectively shaped by that.
It's a brilliant reminder for that.
Yeah. So your 2 years foundational training, you did your 6 areas. What did you choose to go into then?
I
after
didn't.
that, and you didn't.
No.
Okay, let's go into it.
So like naturally, when you finish or when you're about to finish, you apply for a training. Like if you want to be a cardiologist or you want to be a surgeon, you want to be a GP, a pediatrician, whatever. So you choose that, and that's what you do then. Okay,
Yeah.
you have some further training. It can take a few years, but like that's what you'll do, and that's.
And it obviously has to be one of those 6 areas that you've chosen.
No, it doesn't have to be one of those 6. It can be anything. So even if you like, I never did cardiology, for example, but I could still apply for cardiology.
Right. Okay.
Yeah. But there's like a extra portfolio stuff that you have to do. You have to show that you're keen. You have to attend cardiology lectures and do cardiology teaching, and get. You have to publish some of your work in letters and things like that. So there's a lot of stuff that you have to do behind the scenes whilst you're still working in order to like get your application up. It's like applying for medical school again,
Right.
except the competition is even more intense.
Yeah, it just keeps going up and up and up.
So like some specialities like neurosurgery, they only have like 10 spaces in a year. So unless you're like
in the country,
in the entire country, or maybe 15 places. So yeah, there's not many. The problem is, well, like how many neurosurgeons do you really need? Not that many. You need a lot more GPs, and you need a lot more A&E doctors and things like that. So you'll have more places there, but naturally you'll have more people applying as well. But like if you've got 200 people applying for like 5 seats or 10 seats, the competition ratios are pretty intense, because these are 200 people who are already doctors, who have probably already got a lot of stuff that they've done already. So most people don't get in on their first time, especially to the really, really competitive specialities. Some people take 2 or 3 years to really build up their CV, and then they can get into whichever field that they want to. I was in this boat where, when I was in medical school, I started exploring finance, and really got really built a passion around it. Web3 being like one component of it, Web3 or crypto, or however you want to call it. And I got an opportunity to work in crypto. So I thought, okay, let's just take a break here. I can always go back and reapply next year or the year after, or anything like that, as long as I do like a minimum number of hours. So I was like, okay, fine, let's do that. Let's try it. Let's see how it goes. If it doesn't work out, I'll go back to full-time medicine. If it does work out, it should be fruitful. So that's pretty much what I did. I took a break, and I started working full-time in Web3.
Okay, so after your foundational training,
Yep.
you took a complete break from medicine, from doctoring, to go full-time into crypto.
Yeah.
I want us to go into that, but before we go into that side of things, let's round off doctoring and medicine by having the discussion that I mentioned previously. The way I look at modern medicine is, I suppose on the whole of it, quite a negative view, and things that I post on social media or on Instagram, I highlight the negatives. As a preface to what we're going to talk about now, I want to highlight again that the criticisms I have are not with individual doctors, individual nurses. I am of the belief that the majority is a strong word. There is a great amount of doctors and nurses especially that I think are fantastic. And I appreciate it's an incredibly difficult job to do well. But I've also had many experiences personally. Many people I know personally have also had experiences where they've just had awful experiences with the NHS, with doctors, their GP. Nurses, not so much. For whatever reason, I don't know if maybe people are just more sympathetic to nurses' struggles because they work the particularly long shifts. I know doctors do as well, but nurses especially have to work incredibly long shifts for less money. So maybe people are just more sympathetic to nurses.
Yeah.
The criticism seems to be more on doctors, but I know so many people that have had less than satisfactory experiences with modern medicine, with the NHS, with doctors. To put forth what I think are the main 2 issues. Number 1 is with modern medicine as a whole. I think modern medicine is too focused on curing disease, which is obviously needed, but there's nowhere near enough focus on the prevention of disease through, physiology, through nutrition, through lifestyle.
Yep.
And then part of that is, and it depends how conspiratorial you want to go with it. Part of that is, how much is modern medicine a business of, hospitals, medical institutions have certain endorsements, certain supply contracts with pharmaceutical companies. So it becomes more a business of, we're selling these pills to this patient. They may or may not be the optimal treatment for this patient, but that's what's going to make us money. And then more on the NHS side of things, I think it's great that we've got free healthcare. Obviously, the system in America has its own issues, but I think it's a broken system. And I'm not going to pretend I've got the answers, but I just think the amount of money that's put into the NHS, I do not believe that the funds are being used as well as they could be. Because I just think, hospital waiting lists, the way that some hospitals are understaffed, they say, and I could recount personal experiences, but everyone's got the same stories if you speak to them about they had to wait so long for a test. By the time they got the test, they had a cancer, they had a tumor that was so far down the line it couldn't be treated. It could have been if it had been diagnosed like a couple of months earlier.
Yep.
People that were told to go home, all of a sudden there's a massive issue. You know the stories that I'm talking about, right? What's your experience of these? And I appreciate it's a difficult topic for you to talk about. You're still employed by the NHS, but if you can talk about any criticisms or areas for improvement that you see, what are the areas that you think need to be improved in the NHS and in modern medicine as a whole?
I think I agree with pretty much everything that you've said there. I think the problem is that the system is such that, like, we have, let's say, an emergency department, an A&E department that has a capacity of, let's say, 200 patients, right? But the problem is there's like 400 or 500 patients coming through the door, which means all 500 get suboptimal care. That's like the first problem. Many times I've had to treat patients in the corridor because there just wasn't a room free. And like, we've got a growing population in the UK, a growing elderly population in the UK. Unless you're able to match the demand that those bring, or that there's no way to really tackle this. So you need more hospitals, you need more staff, you need more funding essentially going into all of these things. And the funding doesn't match up with the demand. That's essentially the problem. That's why people have problems with their GP. That's why people have problems with long wait times in A&E. That won't change. It's only going to get worse. Okay. I feel sorry for like the staff that work in the NHS, because it's extremely draining, like mentally. Because don't get me wrong, I've seen many cases where I'm sure a doctor would love to spend more time or really explore these options, but they just don't, because there's 50 other patients waiting as well. And you'd rather, you have to at least give care to everyone that's there. So like that is a problem. I don't think that's going to change. That's why we're seeing some elements of the NHS privatize a little bit. It helps to speed things up, but obviously then patients have to pay. I don't know if there's any way to really fix this. Like you said, like you've got free healthcare, and then you've got the opposite side where things like in America where everyone's got insurance. Maybe something in the middle, but I don't know. I think ultimately you'll have people that get suboptimal care in all three of those scenarios. I don't think there's any perfect healthcare system in the world. There'll always be people that have issues and problems. Because of the demand, and because of like overcapacity, and because of lack of funding, we don't have time to focus on prevention, which is the most important thing. Like, you'll save so much more money if you focused on getting people to do exercise, getting people to stop drinking, getting people to stop smoking, getting people to focus on nutrition. If people focused on those four, you wouldn't have any of these cardiac illnesses, these respiratory illnesses, these renal illnesses. Like, those would reduce so much that you probably would save that money from there. But like, there are obviously prevention programs, but when you have demand like this, it's really difficult to focus your attention on that. When I was in GP, I did this a lot, like prevention planning, and like giving people advice on like what to eat, or what, stop smoking, stop drinking, doing all of these things. But like, at the end of the day, like, there isn't that much time. You've only got 10 minutes with the patient. How are you supposed to tackle that when they've come to you with a problem as well on top of that? So you tackle the problem first. Usually by the time that you've tackled that problem, you're already over your time limit. So when are you going to give advice for prevention? You got to book a separate appointment for that. There isn't any appointments. People can't get appointments. So the whole system, I think, needs a little bit of a revamp. The honest answer is I don't know how to do it. But yeah, I agree with you completely. prevention should always be the focus. If you sort that out, you won't have these illnesses in the first place, which most of them are self-inflicted. So that's one thing. And then the other component that you mentioned was the like business side of things. Yeah, I see that all the time. I can see, because like on our system, we can often see like the price of the medication, and like we're often like really drilled into like, oh yeah, give the cheapest one, because the money that the system has isn't enough. We need to save costs, and sometimes you might not be giving the best, but something more optimal based on like the everything as a whole, a holistic approach. So yeah, that is always going to be a problem. I don't know how you stop that either.
Yeah, that's it. It's easy to point out the problems, right? And I don't want to be one of those people that just points out the problems and doesn't offer solutions. But I have nowhere near enough knowledge to begin to hypothesize how we can fix this problem. But I do think it's fair to say that it is a broken system and something needs to change.
So you need more money, right, in order to fix these problems. You need
or better management of the money.
Yeah, you definitely need better management as well, for sure.
Because I think that's a massive. The amount of money, taxpayers' money, that goes to the NHS, I struggle to believe that we can't produce something better than and more efficient than what we've got.
Absolutely ridiculous how much money this government wastes.
Yeah.
What was it? Track and trace or something like that. They spent 30 billion or something on it. No one used it. Yeah. I think management could always be better. But, you know, that's for them to sort out. We can try our best, like at the ground level, but our words as doctors often don't get looked upon by the seniors.
Yeah,
and by the directors and, you know, the people on top.
That's it. There's so many issues, isn't there? There's the institutional and systemic issues that we've just talked about there, and then there's even something, and this is true of any walk of life, any profession. But another issue that I've encountered myself and people close to me have encountered is the individual problems of individual doctors. Certain arrogances of a doctor thinking they know everything and assuming they know the problem with a patient. The amount of people I know that have gone to their GP with a physical issue and their GP's told them it's in their head, and then 6 months down the line, oh, we found a certain problem, an autoimmune problem or something else, and that their GP just a few months earlier were telling them they're fine, and it's a figment of their imagination. Almost.
Yeah, that's crazy.
And that's
I would never do that.
Yeah, that's it. And I goes without saying, I know that, and I think if every doctor was like yourself. I'm not just saying this to blow smoke up your ass, but I know you personally. I've known you for a long time. If every doctor was like yourself, I think the NHS, the institution as a whole, would be much better regardless of the management of funds. Because at the end of the day, an institution, yes, it's all about the management of it, but it's also the individuals to make it up. It's like society. We can, revamp the courts, revamp the judicial system, but the health of society from a justice point of view, at the end of the day, is going to be dependent on the individuals in that society, their moral compass and all those kind of things.
I think at the end of the day, it comes down to a funding problem. If there was more funding, even things like GPs would be able to investigate more things. Then they're limited. They have X amount of money that they have to use, and they're not allowed to go above that. And every time you request a scan or investigations or even bloods, it costs a lot. And like the problem is like the GP practice will have to like manage and like I think the majority of doctors are fine, but yeah, I think just with every speciality in the world, there will be some.
It's true in every job. You know what I mean? You'll
get some accountants that aren't so good. You'll get some engineers that aren't so good. Some lawyers that aren't so good.
But the problem with that in medicine is, I just feel like it's not good to come across that in any field. But especially if you're a policeman or if you're a doctor, your ego's got to be in full check. You cannot have room for arrogance. You cannot be making assumptions about people and not open your mind to the possibility that you could be wrong. Because I just think when it comes to people's physical health, and
you don't want to take risks.
You can't take risks. Yeah. So yeah, they're my main criticisms. And like I said, I'm not going to pretend I've got the answers. I'm not sure that anyone does individually, and that's why it's important that yeah, we need to get together and something needs to be done about it.
Yeah.
But yeah, going back then, moving on from that, you finish your 2 years foundational training, carry back on with the story you were telling us about going into crypto.
Yeah, so like when I was in medical school, I actually started a YouTube channel. I was like inspired by the whole idea of creating digital content, and how you could potentially even make a business out of it. And I thought this would be something that would be a nice supplementary like business or income that I could like grow into. And I really enjoyed the process of storytelling. I really enjoyed the process of creating like education. I think it's something that I've always done, teaching in some way, shape, or form. Even now, like I still will have medical students that come with me, and I love the whole idea of teaching in general. So I basically created a YouTube channel. It was like medical focused to begin with, but like I started to explore finance a lot, and there was this subsector of finance called crypto, and a subsector of that called decentralized finance that really like sparked my interest, because there was like a whole range of like income generating strategies and things that you could do that were really analytical. Like I just loved the whole component of it. And so eventually what happened was I changed my channel from that because a lot of people were asking me like, oh, how do I do this? How do I do that? So I started making more tutorial based stuff related to Web3, especially DeFi or decentralized finance. And I carried that on from medical school during my 2 years, and I was able to grow a little bit of a following, nothing too crazy. But because I was able to grow, I was able to get a bit of an audience, and I think people were able to see some of the work that I was able to do. And that's how I was able to get a job. Someone basically reached out and said, look, we love all of the stuff that you've been building for the last, or creating for the last few years. We're building this financial product. We'd love for you to come and join our team. And yeah, that's pretty much what I joined like a week or two after I finished my foundation training.
Okay. And talk to us about that experience then.
Yeah, so I work for a startup. It's called IVX. It's they're building.
So you still work for them now?
Yeah, I work for them now. I still work for them now. We're building a complex type of financial product called options, and a specific type of option called 0-day to expiry options. And I'm hired to be like the communication lead or like the growth lead. I do a lot of business development. And my job is basically to help get as many people to use this platform as possible. So it is like a trading platform. Has lots of cool features as well. So yeah, that's what I do now.
Mm. I think that's a great testament that kind of links back to medicine in the sense that I think the key theme in the world today is before to gain knowledge, to gain expertise on a subject, you had to go study a degree. You had to go through the academic route. You got your degree, and your degree was a solid rock which showed this person knows X about Y subject.
Yeah.
In the world we're in today, that's completely flipped on its head.
Yeah.
To use the medicine analogy, you can have somebody that's just done research on nutrition or physiology off their own back. They've gone on YouTube, they've gone on Google, they've sifted through the BS, and they've got a really good understanding, and they could have a better understanding on that subject than someone that's gone through all of the incredibly rigorous training that you've talked about. And the same goes for this, because I remember we did like a reunion Zoom call, me, you, Sleta, Shamir, and Parminder in COVID. So yeah. 4 years ago, probably almost 4 years ago to the day, it was in April or May, I believe. And I remember you asked me, because at the time I was still in lawyering and I was involved in financial markets, etc. And you were asking me for like advice and insights on investing, which is obscene now because I couldn't tell you. No one should come to me for financial advice, for investment advice. And you're like the man on it now. Like I'm going to be asked for the rest of the day. I'm going to be asking you for investment advice. Of course, not official.
No financial advice.
No financial advice, of course. But yeah, like you're a testament to that. You just went and built this knowledge off of your own back. Talk about the process of that. How you became. I don't know if you'd class yourself as an expert, but how did you attain the level of knowledge that you have in this field?
So, like, I guess it's pretty much what we've been talking about for the last hour. I love learning and I love education and I love teaching. So, when I was in med school, I used to obviously teach myself medicine, but I also used to teach myself all of this stuff as well. Like you said, you can find everything on the internet. This has been like 5 years, or even longer than that, of like self-development and learning. I read books, I watched podcasts, videos and I practice, and then I taught myself. And I think when I teach people some of these things that I talk about now, anything related to personal finance, investing, Web3, all of this stuff, when I teach other people, it reinforces my learning even more. So yeah, it was a half a decade worth of education that I'm still learning even today. But I think I know a decent amount now. I did some consulting even a year ago. I think over time, like, you just get better at it, and yeah, the more experience you have, the better. That's ultimately what it is. It's just experience.
Before we started recording, we were talking about crypto, blockchain, Web3, and I asked you if you think this is something that anybody that wants to succeed in society today needs to know about. Do people need to be clued up on blockchain? Do people need to be investing to have like skin in the game in cryptocurrency? And you said you don't think they need to. It's something like AI. You don't need to be an expert on AI to be successful today, but it certainly can help to be adept and to have a certain level of knowledge and practice in an area that's as nascent and up and coming as this area. So talk to me about things that you think people that are interested in Web3, blockchain, cryptocurrency, what do those people need to know? Where should they be directing their interest and intrigue?
Yeah. As we were talking before, yeah, I think like AI, Web3 or blockchain, biotech, like those are like, three of the sectors that I think are worth exploring now. I think if you're looking for opportunities, if you're looking to create a business, if you're looking to be in an area which is pioneering the human race, like those would be three areas that I think have opportunities. I think of something like Web3 or crypto as like the internet when it first came out. You have different stages. You had Web1, where you had the ability for people to access information. Beforehand, people were getting the newspaper through their letterbox every day. That was the only way that they were able to access this information. But now you had a 24-hour access to information. You could go on the internet at 2 o'clock in the morning and you could access information. It was a game changer for people. Then you had Web 2 with the social media giants. You had the likes of Facebook and all of these other social medias kind of pop up, where you could not only access information, but now you had the additional component of sharing information, which was again another game changer, because now you could share information even broader. Everyone was their own newspaper, you could say. And now we're in Web3, where with Web2, the problem was that we have these tech giants that basically own everything. Now with Web3, you can not only access information, you can not only share information, but you also have ownership over that information, and you have that via blockchain. And so, like, we're in this new paradigm, you could say, where there are hundreds of opportunities popping up in this space right now. I work in one subsector of this, which is called DeFi. And there's so many other subsectors now that are popping up. So I think, like, if you're interested in this space, I think education is like the main thing. You got to learn about this stuff. You need to know how all of this stuff works. Just like how 30 or 40 years ago, you needed to have a good understanding of how the internet worked if you wanted to create an internet business. So I think just teaching yourself or learning about all of this stuff is the most important thing. There are hundreds of topics that you need to go through, but I think the first thing is like really getting a good understanding of like what the Web3 space is, what blockchain is. And once you've got a really good understanding of that, you naturally explore all of these different ecosystems and applications, and you'll figure out ideas yourself about what you could like explore.
That is the first time anyone's ever explained Web3 to me, to give me some kind of a real understanding as to what it is.
Yeah.
Because what's Web3? What's Web3? And somebody gives you some answer about digital ledgers and blockchains, and if you like me, I just think,
yeah.
But Web1 was going on Google, going on the World Wide Web and accessing information. Web2, social media, the ability to not only access information and share. And now Web3 is Web1 and Web2. With the blockchain technology, you have the ability to secure ownership of it.
Yeah.
Right. Okay. Yeah. Thank you for that definition. I feel like I actually know on a very surface level now what Web3 actually is.
Yeah. And like ownership comes in different forms. Like right now, for example, if you go on, if if you go on social media right now, technically you don't have access to your account. Who's making all of the profit from the content that you make? Most of the time, it's going to be the Web2 giants. Even like via YouTube, like YouTube keeps most of the money for themselves, right?
Yeah.
They only give you a small amount. So like when you use like your Web3 social media account, like you actually own the keys to your actual account.
You've got the IP in it.
You have everything around it, and so yeah, you monetize 100% yourself. You take the revenue yourself. You actually own your social media page there, not some Web2 giant, because like the whole idea of these blockchains is that they are decentralized. There isn't like one corporation that's like running it and taking the fees away. No, that's for you to decide and build.
And that's the whole premise of decentralized finance, right? The fact that a government doesn't own the blockchain,
Yeah,
a big giant doesn't own the blockchain, you own it. You've got the key to it.
Exactly,
And,
exactly. So yeah, I think finance really played a key role in like my passion behind it. Because like with like DeFi, I see there's so many opportunities for people, especially in less economically developed countries, to really take advantage of it. So I'll give you an example, right? Okay, if you think about, you know, all of the countries in the world, you've got countries in South America, countries in Africa, and countries in Asia, which are generally lower class, which are generally less, they have less economic power. In a lot of these countries, people don't have access to banks. People don't even have proper IDs. People don't have access to financial infrastructure like we have over here or in America or in the rest of Europe. So like those people, how do they have a savings account? If you're living in some random remote village, most people have a mobile phone, but no one has a bank account. Or how do you like get access to savings? Or how do you get access to being able to invest?
How do you take out a loan?
How do you take out a loan? Right? Exactly. It's really difficult. You can't. Now, what people have built on these different blockchains are these different financial applications. So savings account, lending and borrowing, investment vehicles that you can access. As long as you have access to the internet, you can access. They're permissionless in the sense that you don't need your passport and your ID or anything like that. You can just go on Google, you can go onto these different applications, and you can use your wallet, which is essentially your ledger, and you can access all of these applications for these different services. They're permissionless. They're available for everyone in the world, 24 hours a day. Like that's one of the core features of why I found so much value there. And I think right now you're already seeing a lot of people are using these applications. Not in the West. I mean, people are using them in the West. It's very popular in America, Singapore, Hong Kong, Dubai, UK as well. It's really growing. It's Web3 infrastructure. But actually, you're seeing that a lot of people from places like Venezuela, people from Lebanon, people from Turkey, where the inflation rate of these countries is so sky high, people can't save in their currencies. They can't. The only way for them to save is via going on the black market and buying US dollars. Right, and even then, US dollars are still losing their purchasing power every year to inflation. But of course, the inflation of the US dollar is much less than the likes of Turkey, which I think is like 50% a year. So you're losing 50% of your purchasing power every year living in Turkey. It doesn't. Imagine that. Imagine like imagine you made $20,000 worth of Turkish lira last year, and now today that its purchasing power is half.
Yeah,
it's crazy, and so people.
How are you meant to live?
How are you meant to live? Exactly. So people in these countries are really struggling. So what people do is the only way right now is to go on the black market, pay extra because it's on the black market, and buy cash US dollars. And so in a lot of these places, people just have like dollars just stashed under their beds. You can't go to a bank. No bank's going to let you sell the Turkish lira and for US dollars. That's like it goes against the financial corporations. And this is a really common thing. You'll see it in South America a lot. You'll see it a lot in African countries, and you see it a lot in Asian countries, even European countries like Turkey now as well. So like, what are people in these countries doing? They're moving on to blockchain. They're using these financial applications right now where you can get a savings account. You can actually get a loan. You can do all these different things. But with stable coins, which are these dollar-pegged assets that you can buy, these instruments that are pegged to the dollar, and you can buy them, you can sell them directly on these blockchains. You don't have to store them under your bed. You don't have to pay ridiculous black market rates. $1 is $1, and so you're seeing massive demand for this stuff right now. And this is like one subsection of DeFi.
Yeah. I mean, it sounds very appealing to me. I think it's important in this day and age. Like people need to be able to have ownership of their finances.
Yeah.
I'm obviously massive on the sovereignty of the individual. I believe in freedom. I think the way a lot of societies in the modern world today are the way they are ran, whether overtly or covertly, people's freedoms are restricted a lot more than they probably actually consciously realise on a day-to-day basis. And things such as blockchain, from the sound of it, to me, are a way out of that.
Yeah, definitely. I'm already seeing like the impact for all of these people in less economically developed countries, where they can finally have a savings account. They can finally do all of these things permissionlessly. And the great thing is, like, there's no borders either. It's like if you're someone in Venezuela, you can like have the same assets as someone who lives in India, for example. And you can send them across easily. It works really well.
Moving over to another niche, another subcategory of this whole thing. What on earth are NFTs? Why do people trade them? Give me the explanation you gave to me about Web3. Yeah. Give me that explanation for NFTs.
Fine. So by definition, NFTs are just contracts of authenticity. It's just a piece of code that tells you this is authentic or not. What you'll find is that people like will have like these pictures of apes and these pictures of like
that's it. I don't quite understand it. Is it financial investment or is it art? What is it?
Yeah, so there's multiple different subcategories of NFTs as well. So like NFT art will be one subsection. So ultimately, the NFT itself is just the contract of authenticity, and what people do is they attach some metadata, like a picture or something, on top of it to represent that contract. And so when I'm sending an NFT from myself to you, all I'm doing is I'm sending like that contract that basically says you are the owner of this, and it can be verified on a blockchain. That's like the core component of it. And so the idea is, okay, right now people are speculating on like art and all of this other stuff, but the idea is, things like your mortgage deed, things like your life insurance, things like your will, all of this stuff can be secured on a blockchain, and you can have a contract of authenticity to verify
an NFT.
Yeah, an NFT. But at the moment, you're in this like crazy speculation phase where people are like, just basically speculating on these different investment vehicles, like these Bored Apes or these CryptoPunks.
Or people are paying obscene amounts for a digital picture of a cuckoo or something.
Yeah. So like most of it is just a marketing stunt. Like the company behind it will be saying, oh, you get all of these different accesses if you hold the NFT.
Right.
Because you hold the NFT, we're able to verify that you're the owner. And therefore you get access to these events, you get to go to this in real life thing, or you get to join this social group or whatever. So they like make it like this kind of token gated access thing. But yeah, obviously right now, most of it is speculation. I think in future, what we will see is like people will have their mortgage or people will have their car insurance and all of this stuff backed by NFTs, which at the end of the day, they're just contracts of authenticity. You can put anything on them, from something ridiculous like a piece of art or something pretty good like your insurance policy or something like that, which can't be tampered with, which is one of the core components of it, and you can verify who the owner is as well. So that's like the main features of them. So yeah, like that's like the main core feature of like NFTs and why people like them at the moment. I think the speculation phase will always be there for now, but you are seeing some genuine like use cases behind them that are like behind the scenes, whether or not it really takes off, and whether or not like in future your flight ticket or your ticket to go and watch Manchester United will be an NFT format remains to be seen. But I can see a world where that does exist.
Yeah, it all makes a lot of sense to me, and having this conversation with you makes me realise that I probably need to start paying more attention to it and getting clued up on it, because it just seems like a no-brainer to me. The ownership of it, the transparency of it, the fact that this is all secure. People think, oh, I've got an account on Instagram, or something more nuanced than that. I've got my car insurance policy when I access such and such website. Well, what happens when your access to that website's denied?
Mm-hmm.
What happens when your Instagram account's taken away from you?
Yeah.
What happens when your bank account's taken away from you? You don't actually own these platforms.
Yeah.
It's a matter of trust. You're relying on this entity which holds no real good faith obligation to you
Yeah.
to fulfill its contractual obligations. And yeah, 99.9% of the time, things run smoothly, everything works well. But and maybe this is just the way I'm wired. What about that 0.1% of the time?
Yeah,
I think most people are going to be happy to go, well, look, this is the most convenient way to do it.
yeah,
I'm happy to trust Google. I'm happy to trust Instagram, Facebook. I'm happy to trust my bank. I'm happy to trust my mortgage lender, all these things. And yeah, it's probably going to work out for most people most of the time. But I think you're probably wired the same way. I like to think, well, what about the worst case scenario? I don't just want to put my trust into people that I don't really know personally. I don't know where things are going to go economically, politically. I would like to have some security as much as I can, some actual ownership over these things, over my finances, over my investments, things that are important as my will, my life insurance. So it makes a whole lot of sense to me.
it's a core component of Web3: trustless, permissionless access. Yeah,
Yeah. Segueing slightly now, building a brand online. Obviously, that's been a part of you moving from medicine into crypto, into blockchain. You've built your brand online from nothing, as you said.
Yep.
You've given me a lot of advice, and thankfully, it's starting to pay off now, which I'm very thankful for.
Yep.
You've shared with me some really good insights. Talk to me about building a brand online for people. I think anyone today really should be building a brand online. If unless your goal in life is to pursue just a very traditional profession, something like corporate law or medicine, it's a very established profession where you don't need your own kind of public brand in the way that you do for any other industry. Unless you're pursuing one of those traditional fields, I think building a brand online is pretty essential for whatever your business is. So talk to me about that. How can people go about building a brand online, and not just building one, but really thriving? Like, how can people get eyes on their content in a world where everyone's attention span is being fought after so competitively?
Yeah, so like for me, like my journey started because I wanted to build something. I wanted to create something, and like you can create multiple different types of products. You can create physical products. Maybe I would have made like a new stethoscope or some like new fancy. There was a point in time in medical school where I wanted to create a clothing brand. Maybe I'd make some new cool funky hoodies or jeans or whatever.
New doctor scrubs.
Yeah, exactly. Maybe new doctor scrubs. Who knows? Like I always wanted to create something, and so it was always going to be like physical product until I discovered like the power of digital products, where you kind of can create something, let's say a video, a course, a book, whatever, in digital format, and you only have to create it once and you can always sell it again and again, which is something I found really, really powerful. Like a video that I can create today, even a year or even 5 years down the line, people could still watch it. And so I love that power that comes with digital products. And I guess like my passion for teaching kind of combined with that, hence why I created the YouTube channel to begin with, and hence why I then kind of branched over to writing articles, have a newsletter, and all this other stuff as well. So I think like that was kind of where it came from. I guess my advice to people who want to do this as well is really focus on a niche. Like you can't just one day talk about traveling and the next day talking about finance and the next day talking about cars or something else. It has to be focused. So you need to have some sort of a niche. And like we've discussed many times, it's all about being consistent. I've never really had a moment in time where my growth has been explosive. I have just slowly just grown month over month, like with more content. So I'm still yet to really go viral or anything like that, but I've been able to grow enough of a following where I can sustain a living from it to some extent. So yeah, it's all about that. I think one thing that I found was like making content about something you're passionate about or something you're interested about really helps, because it doesn't really feel like work then. It feels more like something you enjoy, something, a pastime of yours, and you're like combining it with work, which I think is a really powerful thing. Yeah, I think once you figure out like what works for you, for some people it's more like written form, for some people it's more video form, for some people it could be another form, a designing form, because products don't just have to be articles or videos. They can be files, designs, patents, anything like that. They all count as digital products. So yeah, I think whether you're a coder, designer, you have a blue collar job or white collar job, whatever. I think like there is an opportunity for you, and I think now it's really people really notice now, like the power of social media. If you ask preschool children like what their favorite job or what they want to do when they want to be when they want to grow older, is the most common job right now is a YouTuber. Which just goes to show, like,
I'm so glad you said YouTube, because I thought they were going to say TikToker, and I was just thinking,
yeah.
which I suppose isn't really that different. It is though, right? Well, we can get into this short-term content versus long-form content.
Yeah.
What I like about YouTube is it's still, and obviously we've got YouTube Shorts now, but with YouTube you can produce a 2-hour video like a podcast, or a half an hour video on decentralized finance. People can watch it and garner real education and information.
Yeah.
Versus TikTok, where you can gain education and information, but so much of it is just 7-second garbage. Yeah, I just, that's what I like about something like YouTube or a Substack. Instagram maybe isn't as bad as TikTok, but yeah, talk to me about that. What do you think about TikTok?
The attention economy is like really, really interesting.
That's a good way to put it, rather than TikTok. The attention economy.
Yeah, it's really interesting because of like how our brains are wired, and like how we often seek dopamine as like this reward chemical, and we get it from these colors, these sounds, and like taste, yeah, and like TikTok's really nailed it down. If you ask most people, they could easily sit there and scroll TikTok for like half an hour to an hour, because there's just so much content, there's so much dopamine that you're like taking in. It can be addictive, dangerously. And I think like people are capitalizing on that for sure. Like that's why short form content is growing so big over a short period of time, because it just capitalizes on people and their dopamine, really.
Yeah. But that's it. I think it's so dangerous, and I think that's what I like about YouTube. I think it's still long form content still has not just a place on YouTube. That's predominantly what YouTube is, and that's what I like, because I think as much as you might be able to gain a little nugget from an Instagram video or a TikTok, you're not going to become an expert in a field. You're not going to get a real bedrock, a real foundation of knowledge in any area unless you actually do long form proper study. And that's what YouTube is. That's what like a Substack is. So I'm a big fan of that, because my standpoint is that, yeah, you might be able to get a few gems. You scroll TikTok for 2 hours, you got a couple of gems that might have helped you, but it's actually a net negative, because you've just been sucked into this addictive, dopamine chasing spiral.
Yeah.
You've been staring into a small screen for ages. Obviously, there's loads of physical health consequences from that. From a mental health standpoint, probably going to end up feeling pretty lonely, because you feel like, your connectivity socially is now dependent on this app.
Yeah.
I mean, I think there's a whole host of problems with it.
Yeah, there is. And I think like if the problem nowadays is that like if you're a content creator, you have to do short form as well.
Yeah.
Like otherwise you can't.
No, I'm sitting here talking about it. I'm obviously part of the problem as much as anyone else that's on social media.
And so like even recently I started like making more shorts myself, and probably will keep posting them, because like it's one of the best ways to grow at the moment. But my favorite is still long form. Like most of my videos are long form, most of my articles are long form, most of the stuff that I consume is long form. But yeah, the way that humans have like kind of come through that COVID period, we're very, very different to what we were 10 years ago. And so yeah, I think I'm not the biggest fan of short form content. I think, like you said, there's lots of harm, and I don't think people are really using it to their advantage. But what can you do? You have to just
what can we do? I'm going to put that question to you, because I'm an optimistic and positive person, really, but I've started to look at the future of humanity quite cynically, and I'm looking at where things are going in terms of humans' physical health, mental, emotional, whatever you want to call it, spiritual health, and I'm not liking what I'm seeing. Everything from nutrition, fertility rates are down, testosterone levels are down, all of this stuff. It's all coming from nutrition, sedentary lifestyle, lack of exercise. sitting on your phone, lack of real social connection. There's so many elements to it. They've all kind of stemmed though from modern living, and I know I'm the guy that demonises modern living. And again, what's the solution you're putting forward, Aaron? I'm not sure, because we can't all just return to the savannah in Africa. That's a time gone by. Where do you see the future of humanity going in like 50 to 100 years? Because I've put forth this hypothesis, which I hope is wrong, which is that in 100 years, humanity is going to be extinct. Humanity as we know it is going to be extinct.
You mean like from killing themselves from all of the things that we're doing right now?
Yeah. Well, I listened to this podcast recently where in South Korea, another country in Far East Asia as well, basically their physical health has gone down the toilet so much that they're struggling to have children. They don't even have the motivation to have sex anymore. And then even when they do, they're actually struggling to procreate because their testosterone, their endocrinology is just absolutely shot. And again, it's from so many different lifestyle factors. But I just think that mixed with the fact that people aren't living in real life anymore. They're sitting inside on their phones, lack of social connection. I just think everything seems to be going down to me. I know that's a very cynical way to look at it, but I just think and I hope I'm wrong, but if we just keep going down this form, I just think in 100 years, if we're still here, if the planet is still able to sustain humanity, then are we all just going to be hooked up to machines? We're not actually able to go outside and walk. Like, I just think humanity as we know it is going to be extinct unless something changes.
I mean, I agree. We've got the highest levels of obesity ever. We're all working from home now. We're all glued to our phones. We don't go out anymore. We don't talk to people. We don't meet our friends. We talk to them online now through a screen. I mean, I have similar views to you on that.
Well, what are the answers? Guide us.
I don't know. Like, I think perhaps like with the advancement of things like AI, perhaps like some of the stuff that we do today can be automated, and that means that we actually have time to go out and make social connections and do exercise and eat healthy and focus on that sort of stuff. But I think like we have to solve like all of these problems one by one, and like first of all, if you take the food problem, right, how are you going to stop the likes of McDonald's and the likes of like these big food giants like to take over? Like people are becoming sedentary. People don't eat well because we're seeing more and more of this stuff every single year. There's like a new food giant that pops up every year. Like if we're not going to fix that, like how are we going to fix the obesity problem?
And they've got it down to they've got, I say nutrition, lack of nutrition. They've got the taste down to a T, the same way TikTok has like the attention economy down to a T.
Yeah, exactly.
McDonald's tastes good, man.
Yeah,
that's a shameful thing for me to say, but McDonald's tastes good. And as much as I know it's garbage, and as much as I like to think I'm more sophisticated than eating McDonald's, I still do it more than
it's the dopamine.
Want to. They've got scientists engineering the taste of it.
How are you going to compete with that?
Exactly. Like how you know what I mean? You've got to have so much willpower, and thankfully I like to think of myself as someone that has enough willpower. So it's only once every few weeks, but for most people it's once every day. And as much as you want to sit here and say you've got to be accountable, you need to be more responsible, it's on you, which it is. At the same time, you can only sit here and say, well, I can't blame you. I can't blame you. Like, you're fighting against millions and millions of pounds of investment into these products, which all that investment's going into getting you onto the hook.
We're really going through this weird phase in life where I feel like people's quality of life, even in economically developed countries, is not as good as what it was perhaps 100 years ago. Even though we're living longer and we have better healthcare and we have more access to information and everyone has internet and things like that, I feel like people's actual day-to-day life is becoming more and more difficult. I don't know if this is because of the general cost of living crisis across the world. I don't know if this is because of war or kind of government oppression or what it is exactly, but I feel like from an individual perspective, if you ask, I don't know, I'm just assuming, by the way, I haven't got any facts to back this up. This is just something that I was just thinking about, is the overall assumption that I have is most people today are living more like a slave than they were perhaps 50 years ago or 100 years ago.
Well, I read something not too long ago that in medieval times, slaves were given, and I can't remember the number, but they were given so many days off a year, and it's way more days off than people have today.
Interesting.
Which is like 2 out of 7
Yeah.
days a week. So people are working harder today than slaves in medieval times.
Yeah, it's a really weird one. I don't know like if it's because of like the way that capitalism and consumerism has like taken over, and now everyone wants things like, again, dopamine, right? You
Yeah.
buy stuff, you get dopamine. Like retail has like completely taken over from that with the likes of Amazon and stuff like that. I don't know if it's that. I think it's probably multifactorial, but yeah, I can't. I feel like a lot of people are kind of trapped in their day-to-day lives. We've got everyone struggling to pay their mortgage. People can't pay their bills, and we're living in a country that used to basically rule half of the world,
Yeah.
like 100 years ago. And now, like, the majority of people in this country don't have an income sustainable enough to support your family. You got most people, both the husband and the wife have to work. You can't live on one income anymore. You got people who are having to do multiple jobs. People are working their normal job and then doing Uber at night. You've got people who are trying to figure out like side hustles and incomes and things like that. And perhaps that's probably one of the reasons why people are moving to areas of speculation like crypto, because it's like their lottery ticket out, you know?
Yeah, that's kind of how it feels, right? That
Yeah.
to just have a good quality of life in this in this world now, you need a lottery ticket one way or another. Whether it's becoming a really successful Instagram, TikTok influencer, or getting involved in crypto, whatever it is, it seems like you're either thriving or you're struggling. There doesn't seem to be a middle ground.
Yeah. I think like I see this even like at the NHS work that I do. Like I don't think doctors are particularly doing too well financially anymore. There's a reason why doctors are striking now as well, you know. Yeah, I think I feel like just overall the quality of life that people have today is not what it was in the past.
Yeah.
Perhaps all of these things that we're doing, whether it's consuming content, consumerism by buying stuff, living in this attention economy, living in a 24/7 world that's constantly connected with one another, all of these components I feel are contributing to it.
Yeah, even things like the pollution of the modern world. Water quality today is nothing like what it was 100 years ago. And obviously we need water. Everyone's drinking water every day. That takes its toll over time. I think that's a massive part of it. There's so many elements, like you said. It's multifactorial, and to unpick it all, God, it's a minefield.
But I think like the most important thing is like you realize that. And you just focus on your journey at least. Like, okay, you might not be able to change the whole world, but at least you can change your opinion and the people around you, and kind of take it from there. And that's exactly what you're doing with the content that you make. You're trying to empower people. You're trying to educate them, help them. That's what I do with my content as well. It's very educational focused. It's teaching people, how they can use these tools to benefit their life. And I think if you do that, like you're at least like helping to tackle the problem.
That's it. If what we talked about is very apocalyptic, very cynical, but what you can say to yourself is, look, I can't change the table, I can't change the cards on the table overnight.
Yeah.
But how can I play this hand that we've been dealt to the best of my ability? If you can take ownership of that, take responsibility, and you can't change the world overnight, you can't save the world overnight. Not one person can save the world, change the world, but you can change your own life, and by virtue of that, change the lives of people around you. So that's the approach I have, and that's, like you said, what I hope to do through this podcast, through content, is help and inspire people to take action in their own lives, to better, take control of your physical health. If your GP, whether it's their fault or not, if your GP isn't, giving you the guidance, advice, the protocols you need to better your physical health, you can go and better your physical health. Go on YouTube, go on Google. Yeah, you'll have to sift through some bullshit, but you'll find what you need if you keep going. Unfortunately, we do have to take matters into our own hands, whether it's your physical health, whether it's your mental health, whether you need, spiritual, religious, emotional guidance, whatever it is, take accountability of it. It's easier said than done, but if you can do that and you can find people, friends and family that are willing to do that as well, which can begin to rebuild communities, rebuild connections. And I think that's a massive part of it.
Yeah.
Community. If we can rebuild community, it's hard to organise 1 million people, but you can hopefully organise 10, 20 people. And if you've got 10, tribes, communities of 10, 20 people pocketed all around the world, then that eventually
becomes something.
Yeah, exactly. So on that note, getting back to, some more positive points.
Yeah.
We've talked about your whole journey through med school. Obviously, it's been incredibly rigorous, your whole training as a doctor, and then going into crypto. Needless to say, you've had to become a very efficient, effective, and productive individual. Give me your top 3 tips for productivity. You're like my Ali Abdal. That's how I think of you. You've got such perspicacious insights. You're so productive. Give me your top 3 productivity tips.
I think when it comes to things like content, one of the things that I do is batching. So I'll make 4 or 5 or even 8 videos in one go, in one sitting, and then at least I've got 2 or 3 weeks content to play with. So that's one thing. I believe in something called state flow. It's where once you start working on a task, you're in the zone, and when you're in the zone, you can just keep going and keep going and keep going. And so that's why rather than just filming one video and then doing it again 2 days later and setting up all my camera and setting up all the lighting and everything, I'd rather just film it all in one go when I'm in that zone, when I'm in that flow, and that's really helps a lot. I'm fairly organized in the sense of I have a to-do list, a daily to-do list of things I need to do on that particular day. But in the back of my mind, I also have things that I need to accomplish within the week or in the month. I'm not super strict with it. Some people are really strict with it. They're everything is to a tick box. But
that's sham. He said he organized his day into 15-minute blocks.
I see. I think people work differently, and I think you whoever's watching this video and for yourself as well. You'll it depends on your personality. So I like to have a bit of flexibility because there could be something that comes up and I don't want to then feel bad because I haven't been able to tick this box off. So when I do have a certain goal, I do have some leeway with it. It can be a week or it can be a month or it can be a few days depending on what the goal is. That mentally helps me a lot more.
I'm more like you in that sense. Yeah.
But I still have all of these goals and I still will write them down and I still will have a mental note of them. Sometimes I write them on paper. Sometimes I've got my diary or on my Google Docs or whatever. But yeah, I think that helps for sure. And then having accountability really helps as well. So I think that pushes me to make sure that I'm productive. If I don't get this video out, my fans will be questioning me. You can even go to the extreme length of things where you force yourself to be accountable, where you're okay, if I don't do this task by this day, I have to give £50 away to this person or whatever, or I have to go and buy a treat for this person or whatever. So that financially financial accountability can be one thing. Otherwise, in general, I think I'm just a bit of a workaholic. So I think generally I'm always working on something. That means I'm generally always productive. I just find enjoyment in work. So that really helps. Whereas perhaps maybe 15 years ago, I probably would have just enjoyed being on my PlayStation or being on my Xbox all day. I don't have the same passion for that anymore, and I have a passion for education and a passion for teaching. It doesn't really feel like work for me even. So yeah, that really helps. There was a time where I really enjoyed using these different apps, Pomodoro techniques and all this other stuff when it comes to revising and when it comes to working.
What is the Pomodoro technique? I've heard that talked about a lot
on
social media.
So essentially it's a technique where, off the top of my head, I think you split up your time in 25-minute blocks. So you'll basically work really hard for 25 minutes and then you'll have a 5-minute break. And it's basically you split your tasks within each of these Pomodoros. And it's basically meant to help you keep track of what you're working on, but also have these focused time intervals where you then have breaks as well. Some people really like it, some people don't. I liked it when I was studying for exams because it worked really well for that. But now the type of work that I do is a lot different, and so it doesn't really work so well for me anymore. So yeah, that's probably the main things. I think if you're just fairly organized and once you're in a routine, I think it's generally not so bad. I think the main thing as well is also for me now, I work from home. I work on my own schedule. So like if I wanted to, I could work at 3 o'clock in the morning, or if I wanted to, I could work at 11 a.m. So I could start whenever I want, I can finish whenever I want. But I always like to have a routine, because I think routine, like over time, you just makes life a lot easier. And so I will always try and start my day at 9 or 9:30 a.m. and I will always finish at a certain time as well. And yeah, sometimes I will start earlier, sometimes I'll start later, but generally by sticking to that routine, it just helps me a lot more. And like because once you've got a pattern in place, you're just able to stick to it a lot easier. Whereas like if one day you go to sleep at 2 o'clock in the morning, and one next day you sleep at 10 p.m. and then the next day you sleep at 5 a.m., you don't have that pattern. It's not good for your health and your well-being as well. But also, like when it comes to work, you can be more productive if you know that you're starting and stopping at this specific time.
Do you take any supplements at all? I offered you a tea or coffee when you first came in. You said you don't really take caffeine.
Vitamin D.
Yeah.
I don't drink tea or coffee. It kind of upsets my stomach a little bit. So yeah, that's it really. But don't take any other supplements.
No, like nootropics or anything like that.
No. You know, I see a lot of people who have some benefits. See a lot of benefits to them, but I personally don't take any at the moment.
Caffeine at the start of this year, I never really was a caffeine consumer before the start of this year, but I started experimenting with it, doing 2 days a week, intensely caffeinated.
Yeah.
And for the first 2-3 months of this year, the effects on my productivity were
really good,
immense.
Yeah.
And now it's worn off.
Do you think it's psychological?
No, it's obviously easy to say no, right? But I don't know. I felt
no. Caffeine, of course, is a stimulant.
Yeah,
so for sure you will be focused. But I mean, in terms of how do you direct that stimulation towards your work, and how do you like not get distracted and start focusing on other stuff?
Yeah, it just I realized I wasn't getting effects like at the start of the day, like immediately after taking it. It was later on in the day. I'd usually get a lack of motivation. So like no matter how tired I am, I usually do all my training in the evening, apart from on the weekends. Yeah. In the evening is when I go to the gym, I train, do my grappling training. For me, like it doesn't matter whether I'm motivated to do it or not. It's easy. I say easy. I can always physically will my body into action, but for me, it's more difficult to will my mind into action to do something mentally stimulating and mentally taxing if I'm not motivated to do it. So I was noticing later in the day, before when I wasn't caffeinated, I was less motivated. So like my work rate would slow down and start getting distracted less. But when I was intensely caffeinated, my motivation throughout the day just stayed on this high.
Yeah.
So later on into the afternoon, into the evening, before where I'd like have a slump and like I'd start doing this, start doing that, like start pondering on something, which is good. Like it's good to have those because I think that breeds creativity. But when you have an action plan and you need to hit, so many different goals and deadlines for certain pieces of content, whatever it is, to have that motivation still riding here rather than tailing off, I was able to just execute. That's the word, execute. I was able to continue to execute throughout the day at the same pace that I was at the start of the day. Whereas before, my rate of execution would tail off because I'm getting more distracted. So it actually helped focus me.
Makes sense. Makes sense. Yeah. Makes sense.
So I said top 3 productivity tips, top 3 cryptocurrencies or digital coins, whatever you want to call them, that, because of course, not financial advice, that people should be taking note of.
I think if I answer this question, I either get in trouble or people lose money. So I can't say that for sure, because the thing is the industry is so new. It's only been around for 15 years, if that, 14 years, 15 years. So like something I say today in a year's time could be completely different. And I learned this the hard way for sure, last maybe three years ago or something. So I can't really advise anyone to look into anything, but I think to buy anything, I should say. But I think everyone should definitely look into what Bitcoin is. Everyone should definitely look into what Ethereum is. Those are like the top 2 crypto assets, and there's so much value that they can provide. I'm not saying you should buy it because prices are significantly higher than what they were 1 year ago. So you could be exit liquidity if you buy right now. But I think there's certainly lots of value for people to learn from, just from them 2 alone. Not even just from a buying perspective, but just from understanding like what the point of them even is. Yeah, stick with them 2.
Okay.
Anything else, 100% I could get in trouble.
Okay. So Bitcoin, Ethereum, and they were like the first two major.
Yeah. So Bitcoin's
coins,
the biggest. Bitcoin's the biggest. Ethereum's second biggest.
Right?
Yeah, and they're quite a bit bigger than everything else.
Yeah. Okay. So they've maintained that position.
Yeah, for half a decade plus. No,
Mm.
long. Bitcoin's been number one since forever.
Yeah.
Since it started. So yeah, 15 years. But yeah, I think there is value to actually learn what they are and how they work.
So, as I mentioned before, you're Muslim. You've always been Muslim,
Yep.
raised Muslim. I asked you about how your faith helps you in your role as a doctor, especially in regards to mortality, having to deal with patients passing away.
Yeah.
How much does being a man of faith impact you on a day-to-day basis through your work? How does it motivate you to work harder? Do you feel it gives you strength? Talk to me about your faith. Talk to me about Islam.
Yeah. So like I think when you live in this world, I think it's very easy to get distracted, and it's very easy to think of success as things related to monetary value. You can think you're successful because you now have a $10 million income a year, or you're successful because you own this or you have that, all of these worldly possessions. And so one of the great things about religion that I've basically learned over the years, and sometimes it can be still tricky, but it's that like all of this stuff is pretty meaningless actually. What the car that you drive or the house that you live in or the country that you're from doesn't really matter. What matters more is like how you treat people, how you look after people, your morals, your values. I think those things are like way more important. So and Islam definitely helps with that. It's a guide on how to live, so like if when you ask, or when someone asks like what is the purpose of life, for me it's like following the teachings of God and following the teachings of the Prophet, which have been given to us, and I think it makes life a lot easier in terms of like what you need to do and kind of how you need to live. You've got a certain rule book and certain things that you need to follow, and it helps you to also avoid the things that other people can get consumed by: consumerism, the attention economy, all of these things that have harm in some way, shape or form. It helps you try to avoid them and focus on the things that are important, which is your values and your morals.
Yeah, I mean, going back to the issues in today's society, from my point of view, a big part of it as well is the degradation of religion. The fact that we've become a more godless society. And I'm not saying that everyone needs to be religious, everyone needs to believe in God or connect with God, whatever that may be to people. But I feel as though religion always gave humanity that moral compass and that guidance to the fact that there is something more than just the sofa we're sitting on, the money in our bank accounts, how many crops we ploughed today, all that stuff. It put us in touch with the essence in life. And I think we've lost that to a great extent. And without that, people are just focusing on things such as consumerism, how much money they make, how many people they've slept with, things that society on a very shallow level values.
So yeah, I'm very happy with my faith. I think it gives me a way to live life. It's guidance, and helps me to avoid a lot of these things as well, which society values right now, but I don't.
Yeah. So then, as a finishing question, you've kind of already spoke about this really, but what does success ultimately mean to you, and what is the meaning of life, and are those two things the same to you?
Yeah, they probably are somewhat similar. There's definitely overlaps there. Like I said, I have a guideline of how I need to live my life, which are the teachings from God and from the Prophet Muhammad. So I think that's the way that I live my life, and I think if I can follow those, that's a successful life, in my opinion. It's like I mentioned as well. It's very easy to get consumed in the worldly possessions and kind of all of these things, which to me are meaningless, because at the end of the day, I'm going to be like the patients that I've seen, like we talked about before. That will be me one day. It could be tomorrow. It could be in a month. It could be in a year. It could be in 50 years. I don't know when my time is up. So for me, it's important that I should treat every day like it's my last. I should live the time that I do have here to the maximum when it comes to how I treat people, how I respect people, and the actions that I do day to day as well. I think all of that kind of encompasses together. It's easy to like think that you're going to live till you're 90 years old. Very, very easy, but you never know. You literally never know. There was people in my university that passed away. Yeah, there was a very close doctor that passed away. That from who graduated from the same medical school as me and went to sheriff.
And
Wow.
Okay. Yeah, it's a very close time.
Yeah, and he died in a car accident. So the thing is, like, you never know. I never know when like something could happen to me next week, and I have to think: have I lived my life to the maximum? Where if I were to be questioned about how I've lived on planet Earth, have I done it in the best way possible? Have I? That's the question that I ask myself. And so, yeah, it's a constant battle. You have to constantly improve yourself. But at the end of the day, like focusing on that and remembering that in the back of your head is always a very, very important thing, and really will help you to live your life better.
And I guess that impacts the balance you have at the end of the day. We talk about work-life balance. I suppose being a doctor, a lot of people won't find that deep existential fulfillment in their work. Probably not if they're just working, an office job where their role is to just make, put numbers into a spreadsheet, make some rich people a bit richer. But being a doctor, I imagine that's directly correlated to
that's what I said. That's what I said to you before. I really enjoyed my time working in medicine. I still work in medicine.
Yeah.
Like now it's just part time. But that's
what is your role now in medicine?
So I am basically a locum doctor now, so I can basically pick and choose where I want to work.
Oh, okay.
Yeah. So I still really enjoy that. I find it really fulfilling. But as I mentioned before, like I'm an educator. I'm a teacher. I love doing the teaching work that I do with Web3. I find it benefits so many people across the world. I find that I can provide so much value to, potentially millions of people across the world. So I enjoy both, and both of them are really satisfying to me. I can't say that like I don't enjoy both of them. And yeah, I think my goal at the end of the day, in my opinion, my meaning of life is to provide value for others, because I've been very blessed with what I have. I've been blessed to be born here. I've been blessed to have a great education. I've been blessed to still have a family. I have literally everything in the world that you can think of. I already have. I have a car. I have finances to live. I have the best clothes. I have the best watch. I have everything that I could possibly dream of. What more could I possibly want? You know what I mean? This is something that like I see a lot with some of the other people that I work with in crypto. Like once they reach like $100,000 or $1 million, like it's not enough. You're always thinking about what's next. There's always someone who will have something bigger and nicer and shinier than you. But that competition, or like that I don't know what the word is to describe it, but that feeling that you're inferior to someone else because of worldly possessions that they have, is a very bad and toxic trait to have. And so, yeah, for me, it's all about figuring out like, what is it that you can do to provide value to others? And because I've been so blessed, like my job now is to provide value to other people. And I can do that by being a doctor, and I can do that by providing financial education to people. And so, yeah, that's hopefully the life that I can live from now.
Waj, thank you, man. Really appreciate it.
It was a pleasure.